Oh, yeah, squeeze those in, yep, yep. That's what I read.
All right, let me grab some. Good afternoon. It is Thursday, April 10th, 2025. We're going to have a Board of Commissioners special board meeting today. All commissioners are in attendance, as well as county coordinator and county auditor treasurer. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, I'd like the acknowledgement of the agenda. Can I get a motion to acknowledge the agenda?
So moved.
Thank you, Commissioner. Is there a second?
Second.
Second by Commissioner Noska.
Perfect.
Any discussion? Hearing no discussion, all in favor?
Aye.
Opposed? Motion carried. We have item number 4.1, please.
Charlotte Tavern Incorporated one-year liquor license. Background has been filed in the sheriff's office, and the recommendation is to approve it on sale and Sunday liquor license for Charlotte Tavern Incorporated with the address of 22056 US 71 Montreal, Minnesota, in Lower Prairie Township, effective April 1st, 2025 through March 31st, 2026. I do have some background I would like to say other than what was listed above. The date on here does say April 1st. This will not be retro back to April 1st due to the fact we have to follow the state, and it becomes effective when the state gets their stamp of approval on this. So even though this list, that's just our internal licensing is April 1st.
I have my mic on.
There you go.
I just realized that when you jumped up. So anyhow, back to what I was saying, our office runs April 1st through May 31st for liquor licenses. And this one is how we listed it, but it will not be retro back to April 1st. It'll only be in effect as the date the state stamps it. I also want to acknowledge that Charlotte Tavern needs to realize that even though this is all being approved by the board today, the state hasn't approved the liquor license, and that can take 6 to 8 weeks, especially with being a new licensee.
Okay, thank you very much. I'm assuming our licensee sanitarian could make sure that's communicated to the owners, or they know.
Sure. Or we can contact them too, just so they know, because the liquor license comes out of my office.
Okay, thank you. All right, need a motion to approve that.
So moved.
Motion by Commissioner Denny, is there a second?
Second.
Second by Commissioner Noska. Any discussion? Hearing no discussion, all in favor?
Aye.
Opposed? Okay, ayes have it. This time we will adjourn the Board of Commissioners special board meeting. Thank you for your,
I'd make a motion to adjourn until, what, April 15th?
Yes.
thank you,
And I'll
Commissioner
second that.
Becker. Seconded by Commissioner Newman. All in favor?
Aye.
Aye.
Ayes have it. Okay, now the work begins. We'll move into our Board of Commissioners special work session agenda to discuss Health and Human Services and staffing and state mandate type stuff.
All right. Welcome, Mr. Chair, Commissioners.
Hello.
Just find a spot and sit down. Well, I won't be so far away then. Make sure you guys have plenty of room. Number of items that I do want to discuss and prepare for you today as we meet again. I hadn't heard on any specific items that needing or wanting a special discussion, so I created an agenda and a list of items that I thought would be of interest to you all for us to discuss. Firstly, being just the combined fund balances for social services and public health, 21 fund balance and 11. I find it an interesting, a trend as we prepare for 2026. and looking ahead that how we have positioned ourselves from 18 through 2024. The total county dollars for HHS through those, let's see here, 1, 2, 3, 4, 5, 6, 7 years, including 2024, from 18 to 2024, we are below where we were in 2024 from when we were in 2018. This is handout number 1. So I think we have been, this is proving to you all, or it shows that we've been very cautious on how we are budgeting and spending our county taxpayer dollars, and responsible, and feel that it's important that we try to stay as neutral as we can as we move through the years. There is not many counties, and I believe Doug Host, through Clifton Larson Allen, when they comes in and does the audit, he has stated that from year to year that, we've remained fairly flat as a Health and Human Services. Not many counties in the state can say that, so.
Jackie, if I could, in years past, when we did the budget, we actually took money out. Was it public health? What years were those? Do you have them on? Because as I look at the bottom line, I know there were years that we actually cut the public health funding.
Public Health and Human Services, there was, we do even though our fund balances are separate, we look at it as a combined. I believe one year it was $600,000. It was significantly reduced. Gosh, I want to say, I think that was in 2016, but I don't have that. But through the years, we have had some significant reductions in our budget.
Yeah, for some reason, I'm thinking it was out of public health, but I could be wrong also.
Yeah.
Okay.
And, as we withdrew from South Country Health Alliance as well.
That's correct.
Those dollars came in, and I believe that final payoff happened in 2024. And we didn't we were a pass-through for them to come back to the general fund.
Yeah, so none of that would be on this.
None of that is in here. It may, through Clifton Larson Allen, inflate our numbers. As we were the pass-through, it came back to Health and Human Services and then went to the general fund, but that can overinflate our numbers. But though 100% of those dollars went back to the general fund.
Right, okay.
And then, just in looking at staffing as well, our numbers, you're gonna see that with Health and Human Services is we have a large number of staff. We really try to be thoughtful on the positions that we need with the services and contracts that we have through social services and public health that you're gonna see us ebb and flow. We've seen some reductions through home care, but we also seen some increases with children's mental health. And then we had an additional supervisor added, I think, with John's unit and possibly in Kim's unit as well over the years. John's unit then. Okay.
May I ask a question about the funds too?
Pardon me?
Can I ask a question about the funds?
Absolutely.
Can we talk about this sheet for a second? First, I would also obviously recognize that it looks like they're overall, the county dollars spent have been good stewards of the money. That's great, very great. In the SS Public Assistant Programs, and just because I'm kind of an odd bird here, but how come in even years it's higher and odd years? Is that a timing of something? Because every odd year it goes up $200,000, or it goes down $200,000, and every even year it's up $200,000. What is that timing? Is that a timing deal, or was that just
It might be
patterns, or what?
patterns. My only thing is, you said, which line item was it?
Public assistance programs, they go up, they flex from 8 to 6 to 6 to 9 to 6, but it's always odd and even years.
I guess I never, and it could be due to, is it due to
spreads-
the legislative budgeting year?
That's, to me, there's got to be some reason why it flexes about the same amount every
So you
other
have
year, but
one year that's a budget year and one year that's a policy year, and that might be reflective because of that. But if that's on track, so this year is 2025,
yeah.
does that seem to track with those biennial years with our state budget?
I'm not sure I even know
Period.
the whole,
So,
It
Other
was
than
just-
that,
it was
I
just a
don't
quick,
know
you
that I can identify really what
Okay.
that trend might be causing that. But that's something I didn't pick up, so I appreciate that.
Okay. Any other trends like here? Like, I mean, it looks to me like children's services are continuing to, you know, over the last 6 years, they had a few, but the last 3 or 4, going back to 22-1, they've just continued to.
I have that in the detail as we
Okay.
kind of go through the, yes, but
Yeah,
yes.
and if you want to
yes,
circle back, just say, Bob,
absolutely.
you'll
Yep.
get it in a little bit. Thank you.
Yep. Any questions about handout number 1 that you want to talk about in addition?
So details on how most of this is going to come
Yeah,
up.
details are in the pages to follow. And it breaks it down.
Thank you.
But we can always come back if you have any questions. That's why I have them numbered, so we can all kind of stay on track to what is in front of you. So if you go to 2, where it's the public health areas of responsibility and fund balance, there are 6 essential functions to public health, and we do break those down. How they are allocated can be by grants and the work that we do. You're gonna see that ebb and flow through the years, but stay fairly consistent. The years we'd found to be beneficial for public health in funding was during COVID. As COVID happened in that year, it was a budget year, so that was very beneficial for public health, and there was a lot of grants that we seen come through and a lot of work with additional funding. But assuring, as you see these 6 essential functions, we also have the fund balance on there, and we are exceeding a 5-month fund balance for public health as well. But some areas of, our largest one is assuring quality and accessibility of services, and under that, we're gonna see the CTC outreach, some discharge planning, follow-along program, interpreters are coming out of there, min choices, care coordination, service coordination, and then some grant work. But that's fairly typical from year to year. Anything you want to add on that, Catherine?
Yeah, I just say I know the COVID dollars have been a discussion since they were cut recently. Fortunately, we had already spent the majority of our dollars, so that didn't impact our public health agency, which was good. There were some vaccine dollars that we did not plan to spend and already told the state we'd be returning those dollars since we were no longer provided COVID vaccines. Those COVID dollars came in late, as you know, kind of past the pandemic. So they were used by our existing staff. We didn't add any new staff during that time.
As we are a CHB, a community health board, we belong with Morrison and Wadena counties. Those are public, 99% of our public health dollars are filtered through that CHB. We were fortunate that, and smart that we spent those dollars, those COVID-19 dollars early. We are gonna see, or you're gonna hear some of those dollars were not able to be spent in Morrison. And then there was a grant that Wadena County had led on around initiatives that those dollars were restricted with some of the pullback from the federal government. So, but we did spend our portion as a third that we have had. Okay. All right, so if you go to page 3, again, these are just graphs. Randy did tell me that he does like graphs, and they are easier to follow. But you're gonna see the majority of our expenses for public health are wages. Graph number 3, or page number 3, and fringe benefits. So we stay, over the years, fairly consistent. And then on the back side of page number 3 are the revenues. And again, covered mainly by grants.
Yeah, I would just say again, we have 15 grants that I manage for public health. So there's only 2 that are expected to be completed in the next 2 years. The rest are ongoing grants that we manage over time. Grants are different. We have our staff divvied up amongst multiple grants. It's no longer where you get a grant, hire a staff. That's really not a sustainable solution. So we've really worked to make sure that our staff are diverse across multiple grants, and so that they're doing similar items for different grants, right? So we're best utilizing our staff and making sure that we aren't sort of pigeonholing them into one grant one project, right? So that's been a really good model to kind of keep our nurses covered by some grants and to make sure our support staff are well utilized.
I just want to pause and leave you some time if there's any questions.
I got a question. Okay, we're in the CHB. So do we, all of our grants are written through that, or do we write separate grants through Todd County separately?
Correct. We do. There, as you know, Todd County has a unique population that's different from Morrison, Wadena. So
Right.
we have written separate grants. We initially had a Healthy Homes grant that was only in Todd County. Now it's a CHB grant. We have a Promising Practices grant focused on our Spanish-speaking population. That's a Todd County only grant. And then all the funds are a little bit different for each grant, right? Some come more to Todd County than the other counties based on need.
Say, Catherine, quick question. And I'm not looking at the chart, but are those mostly, do you know if they're federal or state, what the breakdown is across those 15?
Yeah, I have a big giant spreadsheet. It's difficult to look at. It's a mixture of state and federal. WIC is one of our largest federal grants. That's really our largest one that we receive. But we also receive a lot of state-based funding. That's our local public health grant, TANF, MCH. That's block funding from the federal government. So it does trickle down from federal to state. A majority of our family home visiting grants are state-funded. Again, it's a combination, right? Some of those state funds are federal funds, right, that the state has allocated. So there is a spreadsheet I can send out that shows each one of those grants and how long they're funded for and where they come from.
Just a follow-up question, are any of them going to get dropped or?
Yeah, Healthy Homes is a 2-year grant. It ends next June of 2026. Our CDC infrastructure grant, which is focused on public health workforce development, ends in 2027. And then we received just a short grant, our CSUP, we call it, Cannabis Substance Use Prevention Grant. So with the legalization of cannabis, they provided some education dollars to each CHB as well. That will end next June as well. But again, we don't hire new staff for those grants. We do them the best we can, utilize those dollars well, and they're small dollars.
Okay.
And Catherine, I'll let you answer this question. Do you feel that any of them are at risk of ending? I mean, granted, we don't have a magic 8-ball. It's going to be, I'll let you answer.
Well, we've heard that MDH is cutting a lot of staff, and you guys have all heard that, right? Due to their restricted funding and their funding from the federal government being cut. I am concerned. Typically, the way it works is federal dollars come to the state. State keeps about 25%, and then 75% comes locally. Generally, that's how it's done. Am I concerned the state might keep more dollars? Yes, but we haven't heard any of that yet. So in all of our grant agreements, and a majority of those run 5 years, not 2, which is good, those dollars are set, right, and part of base funding. They're not part of, so they don't typically get changed in those legislative years. But again, we have a lot of uncertainty right now, and I know MDH just cut about 200 employees, so it's hard to tell what will happen. But at this time, no.
If I may, on the back of 3, talks about the revenue. What do you know what is causing the fees for services, other to decline over the last 6 years? Is there a specific, just curious. Or maybe even explain what that fees for services, other, is that a big bucket with a lot of stuff in it?
So again, fee for service would be third-party billing, would be our home care program, right, has gone now, right? So anything we charge for. And that number, you're right, has gone down a bit. We do a lot less clinics than we used to. We used to do more public immunization clinics, things like that. We don't do those any longer, right? And part of that's just staffing. And again, we are a safety net at Public Health. We promote that people go to their medical home for a lot of that care. We used to do child and teen checkups, things like that. But I believe that's where we've seen the reduction. And then again, home care going away in '23 is a significant change.
And fee for service is basically just billing based on utilization. So if we use it, we bill for it. So if we see those going down, we're able to do those services in-house or don't have a need. That's a good thing.
So you would see a corresponding, on the expense side, you see a corresponding.
Yeah, if you look at the public health budget from '28 to 2014, you'll see it's gone down from 2.8 million to 2.5.
Yeah,
8.6, right?
yeah.
And a lot of that's home care you'll see in the past few years, but the budget has gone down over the last 6 years.
And you're gonna find that we kind of, even with our staffing, we charge staff to public health or human services or social service based on their volume of work, and where it makes the most sense, we can capture revenue. So some of our staffing adjustments are because somebody was in social services end, and we put them to the public health because of our billing, and we're able to capture better revenue by charging their time in that fund balance, I should say.
And just so you're aware, so in 2024, 197,000 of the county tax levy went towards the public health budget. So that's 7% of our total budget, just to be completely transparent about that. And
When
that
there's any
number continues
adjustment,
to.
it really, as big as it looks, it's small on the scale of things because the budget is so small in comparison to the human services
Correct.
budget.
And we try to really manage that effectively, you know, and we all knew the COVID dollars were gonna significantly bloat our agency, right, in a way that, you know, it looks like we have more revenue than we actually have, right? So it'll be nice to see these next few years, and I think that's where we're really trying to keep our staffing down. Our public health nurses are our most expensive. We have 4 of them. I've worked really hard to get a majority of their time covered by grants, and then we're able to bill for their visits as well. So third-party billing is really a nice revenue source to offset those costs too.
Would I be, excuse me, would I be making the right assumption if I thought the revenue from grants in 2025, or maybe not 25, 26, would potentially be less? I mean, based on like,
What year are you looking at?
2026,
like next,
so
you know, the
Looking out.
the bar chart for grants is somewhat in a rising direction, but, you know, if these different programs or different, you know, what the state does for us, do you think that there's a chance that's going to actually reverse and be more of a declining number than an increasing number?
I think we'll have to increase our grants if the state starts decreasing our funds, right? We'll have to go after other grants. So I just wrote a Medica grant for $100,000 to support our new Haitian population, because again, we don't have any funding for that, and the state doesn't have funding for that.
Who would we, this week we had, someone and I had a discussion about the fact that those grants, you know, because so many nonprofits are having potential staff, or, you know, getting cut.
Effectively, right? Because otherwise you're not going to look good to the funders. So I think it's important to really identify what are your needs, where is that funding going to come from, and if you can't find it, you know, then you go out and search for additional funding. And that's a really nice way. Typically, you're going to need a match with our funding. And so, you know, you have to show that you're doing the work, and if you want to expand on it, then you're going to have to show how you're going to do that with these which matching funds, grant funds. And a lot of ours does have to show a 50% match, so it's not something where we can do something brand new without any other matching
And it
dollars.
can't supplant existing.
Supplant, yep.
So, when you say shotgun versus rifle, I've never heard of that, but because I do think some might do that shotgun approach where, you're gonna try and get as many grants as you can, but you can't supplant. So if you're already doing the work, you can't look to another, it's similar to double dipping. You can't look to another source to cover something that's already probably been paid for or covered in another grant.
Thank you.
So, Mr. Chair, you look at the last 7 years with the revenues and expenses, you're fluctuating between 28,000. So it's just like, public health has been pretty steady in the last 7 years. It's the other department that's gonna be the interesting one.
For sure.
You can stay. She's like, okay, I'll see you guys later.
It's lunchtime, right?
Okay. We can always go back. I want to, like I said, leave plenty of time for questions, and silence sometimes is good. All right, handout number 4 is where we're gonna move to the social services side of things. Again, these are larger, this pie is much bigger than the last pie when we look at our graphs as a whole. So again, we break that all down by program with public programs, child support, children's services, child care and MFIP, chemical dependency, mental health, developmental abilities, and adult services. Our fund balance is around 4 months for social services. Our goal is always to keep that around 5 months, but the public health is helping as a combined health and human service bring our total fund balance up to 5 months. So public health is helping us out here on the social services side. We did spend a significant amount of dollars last year on our adult services side, with one individual needing, that did not meet criteria, that we had to pay for those days that he was at the state. So that did not help our fund balance. Yep. But we did have some help from the state with recapturing some of those dollars, but I've got the detail to follow unless you have any questions regarding this pipe. And I'm hoping the detail will help maybe answer some of those questions, but if you have anything you want us to highlight, please feel free to stop us.
So the detail's probably gonna tell me this, but children's services is it's twice as much as public assistance.
Right, and it's the services, again, it's the fee-for-services that
What
we
does that
have
say
in our-
about, I mean, what is that, but what is that kind of, what's the underlying, what's the driver there?
A lot of it is our mandated service, right, the child protection realm, because when you,
John, you want to talk into the microphone?
sorry, yes.
Thanks.
When you get into those mandated services, the child protection realm, that encompasses a lot of those big dollar expenses, right? Our out-of-home placement costs. It covers our court-ordered services that we're providing our parents. So a lot of, when you get into that mandated service, that's where a lot of the driving force is coming from. Those two big costs, court-ordered services for parents and then their out-of-home placement costs.
Would you imagine that's out of the 1.749 million, is that 90, you say the majority, and then 90, is it 51, 40, 30, I mean, what,
So if you go to
I'm
the
trying to put my
detail on
finger on-
page
okay.
5, you can see by the expenses to the revenues. You can see that there's staffing and overhead and program-specific things. And then the other attributing county-supported, and then healthcare access, cost efficiency of health, and then the other. But yes, it would probably help if you guys had a packet, wouldn't it? Or you can see it up here.
Yep.
They did get all the detail yesterday. I did email them soon. They knew what they were talking about. But yes, it is those things and those fee-for-service things, children that are placed in residential settings, child protection that really are hard to predict when planning these budgets. We really, when planning, we look at trends And we sit back and we look at opportunities, we break down contracts and expenses. But yes, those things are hard to predict when looking ahead, because we don't know when somebody's gonna be in a crisis 6 months from now. But also, we really try to do our best with that upstream approach. Catherine's unit supports a lot of the work with around working with moms and pregnant moms and children when they're young. But our children's mental health also supports child protection and really working with these families early in trying to keep them out of the system overall. And we know that that's a generational approach, right? Because sometimes it takes 5 generations to break these cycles. And it's gonna be long. The upstream approach that we do today and the primary prevention is something we're probably not gonna see, but we know may be impactful for families in our county levy down the road. John, any more thing to add regarding children's services and the trends?
No, I mean, when we came before the board, we've talked about out-of-home placement costs, and we kind of talked about that, you know, and right now, we're struggling a lot with a lot of high-needs kids, you know, and when you get those high-needs kids, the services that we have available for those kids is often far apart. There's not openings, they're not able to accept them, so you're paying higher dollars for some of the services that we're getting into. So I don't give you the exact breakdown of what comes into that out-of-home placement cost, but just keep in mind that when you do pay that, a lot of that is high dollar costs.
So, Mr. Chair, I got a question. So out of the, go back to the pie there, and out of those 8 programs, how many unfunded mandates do we have within that pie?
So our unfunded mandates are on page 7, and you're gonna see those things that I listed out there, expenses. We have a number of things for adult services and children's services. If you move down to C, our unfunded mandates, when it comes to specific programs, are $125,000, just over $125,000, $739. That's the targeted case management. Is what I got listed out, and then I've got the benefits that come along with that. But again, that's what's non-mandated, but there are so many other things that play into factor with this pie chart and these costs, like John had said, residential placement, the windshield time. If we have a kid that's placed out of state, and that because we don't have anywhere in-state, there's just no services to keep them here local in their school district, in their communities. It's a significant cost that we
Explain
try
that.
to avoid, but can't predict happens either.
I need a, you know, the Bob explanation, like, we have children that are being protected or whatever out of state, but because were what, born here, or a parent lives here, or they were.
We don't have any currently in Todd County. We don't have kids placed out of state. Across the board, when a child reaches a level of need in a psychiatric care, significant psychiatric care, sexualized behaviors, highly aggressive behaviors, property destruction, all those needs get checked, there's not a provider in Minnesota that will provide that service. So then you're looking out of state. I've had kids placed in Missouri, Indiana, Ohio. There's very specialized facilities that will take children like that, and that's how you end up in an out-of-state placement. We don't have that, but we do have kids that are placed in Grand Rapids, Austin, Moorhead.
Because that's where the facility that
Correct.
treats that
Correct.
behavior
Correct.
is located. And so, okay,
Yep.
that's good to know.
In the adult world, we feel like we don't have enough services, but in child services, they for sure do not have enough services. So they are traveling to the very few specialized services they have.
And I want to take this opportunity to point out, Commissioner Becker sits on this board with the West Central Juvenile Treatment Center. We are very fortunate to be a part of that consortium, that we pay for a bed. So when we have those needs with those kids, we have somewhere to go that fit that criteria. which can be narrow sometimes. We may not have anybody out of state, but there are many counties that are traveling across the nation to see these kids. And it's something that we do want to talk about, that we need services in Minnesota. And sometimes we have to go outside of those state lines to get it. Unfortunately, we're probably gonna see our turn into pickle barrels at some point, because that always seems to happen to a county when they say they don't have one.
Correct.
But we really try to work on keeping those kids out of residential facilities, period, as much as we can, and intervene as soon as we can to prevent that.
And that would be the last resort
Right.
after we've brainstormed and thought out of the box as much as you can, piece together things.
And that's why our children's mental health is so important, because they work with those families ahead of time so that we're not getting into those situations. It's a lot easier to address an issue right away rather than wait for it to fester and fester, and then you have no options. You're stuck and you don't know what else to do. So that's why that service is very important to our county and our clients, basically.
Yep, and I think just talking that preventative, because eventually they'll become adults too, and it still just builds and builds then.
Right.
So it's better to pay for that or invest in those
That
needs early on.
Are we still seeing the 3 or 5 year cycle of kids, and then we see them as adults coming back in? You know, at what point do we start breaking that family cycle?
They say it can take up to 5 generations to break that family cycle. So we're seeing generational cycles,
we still are.
unfortunately.
And I think that's always our hope, that we can somehow break that or instill some sense of something new to, help change the course of how things are going. And we just sometimes continue that through their lifetime.
So, Mr. Chair, have we seen any cuts in the federal as far as funding? Have we seen anything?
I think this is what we're hearing about now. So I am participating, representing Todd County, or Region 5, sitting on a work group with MEXA and AMC and looking at those proposed cuts made by the governor. And those are gonna be more on the adult services side, but we anticipate it's really, they are proposing cuts for 2025/26, because the budget year for the state is July to July, right? So it splits down the middle. The federal government is October to October, and then the county is January to January. So as we look ahead, they're proposing some cuts for July 1st to July 1st of 26, but they're really worried about what it looks like in the tails, so in the next biennium, because those cuts today are only gonna triple fold as they move forward through the next biennium. There are some discussions that we're having as how these cost shifts, as they call it, are really levy increases to the local government, being the counties, and they want to change that wording because it's going to affect our levy if we continue down this trajectory as what the governor is wanting to shift counties. So we're looking at changing some policies around criteria and offering some recommendations to fix what it's gonna look like in the tails, but also hopefully lessen what we have coming in possibly 25, 26. I met with Representative Wiener and Senator Utke when I was down there 3 weeks back, and as Senator Utke said, there is plenty of money to go around. It's just how it's being distributed. And we don't know what's gonna happen. We can't predict. I anticipate we're going to see some shifts, possibly not as significant as what is being proposed, but really what's it gonna look like 2 years down the road is what is our most concerning, and how can we do some policy changes today so it doesn't look so terrible as we proceed on through the years. Hope that makes some sense, so we're looking at some policy changes, criteria, adjustments for some of the programs that we now offer.
I was just gonna say short answer, no, not yet, but who
Yes.
knows what's going on in the news right now as we speak, so.
Did you say, Jackie, that do you think they're more risk averse at going after anything related to child services and they're more focused on the adult services, maybe? Or do you
Yes
have
and
any
no.
sense
I
of
really
that?
see some of these proposed cuts being directed towards adults, knowing that there are some legislative statute language coming around children. And I'm trying to think of, it's come on, John, help me with the MAPPA CW. It's the Child Protection with Disproportionality Act that's coming up, that when we are looking at our cuts and we gave you those proposed cuts, we also added in that new statute requiring more active efforts in the child protection world, what's gonna require more FTEs to do the work. When working with Representative Wiener, he is proposing a bill that delays that, because I think at some point it's not going away. To delay that when we have systems modernization to support the work. So right now, our software, SSIS, cannot support what is in statute in moving forward. It just can't do it. There's just gonna be so much work in the software that until they can get it to where it needs to be, don't make another mandate on us that's gonna cause us more FTEs to support something that can be done through better modernizations of the software. We're still gonna have to hire some staff to support the work, but we need the software to support it as well. So yes and no. Sorry, that was a long answer for a short question.
Mr. Chair, if I could.
Yeah.
Are we in the process of updating our software right now? Is that the part that Jackie's talking or not? We are not, still not. And
That's
what's the
a s-
cost of that? You know,
So, Commissioner Becker, it is, right, the state has invested $10 million to upgrade the software. That's a drop in the bucket. We need a new system, which is gonna take probably about 200 million.
And she's talking about the system that we work in, our social services
yeah, okay,
information system.
through the state.
Yeah.
Yep.
Because we're very green screen, and when it comes to polling data, it's manual polling. We should be able to put in, create a spreadsheet, enter what we need, and it just gives us what we need. We are nowhere close to that. And many times the system goes down. There's a lot of errors and downtime, so they're calculating that as well. It is very,
And we've been working with this system for how many years already? I mean, we've been hearing the same discussion when we go to the state capitol or whatever. It's continuous.
And there's many different systems, but they're all old. She's talking about one where it's literally you have to tab, and if you
Yep.
miss, you have to tab through the whole screen to
Yep.
get back, and then it freezes, and it's a mess.
We need a hammer on Ucky and Wiener when they come on that. I mean, there are direct, they're actually spending, the state is spending money right now to develop some type of monitoring system of the federal cuts that are coming through, which, okay, is understandable, but we got a system that every 87 counties and hundreds of people within this, thousands of people in the system, they're starting something new when we got something already that's broken. You gotta fix your broken stuff first.
and what fears me about that is MinLars. Let me remind you of the system they built there that they had to redo. Every time they touch something, it breaks. Well, and it's so archaic.
On the 2024 non-mandated service expense revenue, sheet number 7, could you help me with, where was it? Under adult services, the Roman numeral 2 or II there?
The rep payee.
What is that? I'm just curious. I don't understand. I don't know what that is.
That's a service we provide for those that can't budget their social security money. We are, through social security, we have their money and we distribute it to pay their bills and what they need that way.
So it's a money management.
And
The
also,
software or
yeah,
something, or just a?
No, it's a simple, what do you call
It's an
that
FTE to
system?
support.
It's a spreadsheet that she budgets
Okay.
their money monthly, distributes it, their housing, their electricity, water, all that gets paid, and then whatever else is left over goes to other bills that they may have. These are the people who have like extreme issues with money, and they've several credit cards. Like, you have to dig them out, but it's also a valuable service because it's our most vulnerable people that we provide that service to.
That have no one else to do it for.
Yes, and that have no one else to do that.
Are there quite a few people in Todd County taking advantage of that service or not?
Through our service, we have about 38. We're pretty
Oh, you
choosy
do?
because at this time, we don't charge a fee for it, where there are other places that do. They charge about $50 a month. So we're looking at if that's something that we need to do, is to start charging for a service like that or do something different.
Okay.
38, that's 38?
Yeah.
I don't know, does that surprise you?
It does.
High or low?
I thought it would have been
Curious.
lower.
Lower?
I
Okay.
did.
Yeah.
Yeah.
I mean, we do serve a lot of people that do have a rep pay, but it's sometimes through a different agency.
You know, because you would think family would be stepping in or church would be stepping in some of those cases like that, then it wouldn't take a government or a county
And
to
we
step
would
in.
love that, but yeah, sometimes families just not able to, whether they're busy, whether
Or they don't
they've
have
burnt-
family.
Yeah,
It's
they
that
burnt their family
generational.
out.
Yeah,
You wouldn't trust maybe their family with their money. A lot of different issues that go around with that.
38, okay, thank you.
So page number 6, or handout document number 6, is that combined Health and Human Services expenses. So, and how we look in comparison to the programs that we offer. And again, as a combined fund balance, we have the 5-month fund balance with public health and social services together. I know a lot of information, that's why I wanted to get it to you early, it's just a lot to consider, and all right, page
Chair,
number.
can I-
Got a question.
Go ahead.
Go ahead.
On the yellow one there, chemical dependency, do you see a possible slight increase when our pot shops open up?
chemical dependency.
There's a couple different things that are going on with that. Our LADC left our agency, so we won't have that expense of having a staff person there, but through our behavioral health fund, it could increase spending that way if people are going to treatment.
Well, chemical dependency will lead to, you know, if they legalize marijuana now, and that's just gonna lead to other chemicals, so do you see that possibly increasing?
Possibly, and it just depends too on what the proposed governor's budget does too, because we pay a portion of that behavioral health fund. So it could increase our costs. We have no control once we enter that behavioral health fund into the system. They could go in and out of treatment 6 times in that year, and we wouldn't have control over that. So it could increase.
That's hard, you know, that's a hard predictor.
It is, you would think it would increase, so.
Yeah, you do.
It's something we definitely monitor, though.
Okay.
Okay.
And then moving on to page 7, I know we had kind of jumped ahead with that before, but just some expenses that I did want to share. And what you have in front of you is different from what I emailed you yesterday, because I forgot to put a few things on there. It was about 4 o'clock in the morning. I woke up and went, I forgot to add this. And then on my way to work, I'm like, I forgot to add that. So this is updated to what I, you know, to my best of my ability at 4 in the morning. But Staples office, there is a cost to that, but we also know what the benefits are to that. So you know, and it's not only Health and Human Services that utilizes that office. We have it across the county, all departments. So again, corrections, veterans, and
Who do we
health
rent
as
that
well.
building from?
We
It's
own
all
that
county
building.
owned.
We're paying ourselves rent on it then?
Yeah, they
Well,
pay us rent.
We do, we capture rent because with some of our programs, we can if we allocate rent towards that. So when we can, we do charge ourselves.
Yes,
So-
it's a per square footage, and it's part of our cost allocation plan. And so they do pay us.
Yeah, and corrections pays us and Region 5, correct?
Region 5's no longer in there.
Yeah, they are.
Oh, they are.
They got an office or
They have,
two,
they
right?
have
Meeting
they
room?
downsized, but their main office is still Staples.
Yep.
Yeah.
We do have staff that's also their primary office.
So it's an expense, I just wanted to list that. Adult services, and I'll let Kim talk a little bit about this, but service coordination, we do manage some products for health, I want to say health partners, health plans, but those are Medica, UCare, Blue Plus, and waivers. And then I know I've got a lot of acronyms there, and I was going to list those out at the bottom of the page and I forgot. So we can get those acronyms to you as well.
I can list them out if you guys
ahead.
really need that right now, but those are our disability waiver programs. You know, so you've got CADI, Community Alternatives for Disabled Individuals. I won't bore you with all of them. If you want the list, I can send you the list. It's not as pertinent to, we provide those waivers, and then like Jackie said, the health plans contract with us to provide care coordination. And so I don't know if this is good timing or not, but we got,
Do you want to explain what care coordination is? So they
Yes, so those that are on MA, Stephen may have to help me sometimes with the rules of this, but if they're under 65, 18 to 64, they can be on our special needs basic care program, so they're disabled and on MA. So, and then if they're over 65, if they enroll in MA, unless there's certain restrictions, I guess you call them, or guidelines, they get auto-enrolled in a health plan when they're on MA. And so the care coordination is something that helps them to make sure that they are getting their preventative care visits, they're getting access to resources, kind of that preventative approach to reduce ER visits, reduce placement in a nursing home, other places like that. They can also be on a waiver too to keep them in their home longer. It's just kind of that resource here at the county that we have that our people can contact to kind of help them through some of those things, whether it might even be housing or they need to get help scheduling a dentist appointment. It's kind of some of those access to care services that are being helped.
We really find that as an opportunity to keep our foot in the door of some of these residents that may not know they need help or know that there's help out there for maybe a need that they don't even know that they have, in offering that. It's that primary prevention and helping them before they get into crisis.
Yes, and so one of our health plans late last week, we had found out that our people that are basically inactive with their care coordination, their refusals are unable to reach, that health plan is taking them back in-house for their care coordination. And so when we ran the numbers, we found that it would be half of like that health plan's members that we would be sending back. So we've been really looking closely at our care coordination program because as you can see, we run in a deficit with that one, so we're looking at what we can do to improve our revenue with that. And one of those things is with sending those members back to that health plan that we would eliminate our open care coordinator position because we feel with some rearranging of caseloads that we can keep the work with the staff we currently have. And we're also looking at other ways that we can reduce those costs.
Okay. And then we talked about the rep payee. And then Children's Services Unit, I think we've touched on that as well. So we're moving into Stephen's unit, the financial services. We have the Energy Assistance Program. And again, this provides assistance to low-income households with energy expenses and emergencies. But not only that, it supports local businesses and doing the work as well. But that cost is just under $21,000. And then we have the Community Health Services Unit. We have a senior coordinator on aging that provides resources to our seniors. But there is a cost of $35,479 for the FTE. And that is a part-time employee. And then we have the fun part, the revenues, the good part. So this is under the Administrative Services Unit. We are able to capture through probate. We've been able to capture $132,229.49. And that is since the initiation of the program. We, I think this year have budgeted revenue of $300,000. So it's bringing those dollars back into the county, and Denise is familiar with this program as well, and getting those properties back on the tax roll. So. All right.
Good.
Okay. Okay.
Going back. There you go.
Page number 8. You've seen this one before. I think we had this at the last work session as some supporting information, but just to talk a little bit about Stephen's unit and the programs and the staff's years of service and the caseload size mixes. But I just wanted to mention, which is why I added the additional handout being number 9 is, counties, we all are mandated to do things through state statute. Some of us dabble in the non-mandated services because it is right for our county and the needs of our county, but also because of our population. As you see in Todd County, we are statistics with children from 0 to 17 on page 9, our evolving workforce, which is not great statistically, and we're seeing an aging population, a diverse population, but also, we're of high poverty rates as well. So the things that we do here in Todd County may look different than what we do, and even from our contiguous counties, because it makes sense for us. But it also is very reflective of the work that we do across the agency. We talk about Stephen's unit as well. There are a number of programs that is offered. You can see a handful of those listed there. With a number, some of them are, maybe I'll let Stephen get into this around eligibility and applications and the volume of work, and then the years of service with the staff, as well as the large caseload sizes.
Sure. I know at the last work session that we had, there were some questions about how many applications there are for the different programs. So I just brought a sampling of, this isn't exhaustive, but each one of these, excuse me, is a different program. There are supplements to the programs. If they apply for one program and it's not the correct application, then there's supplements that folks have to fill out. Like I said, that's not exhaustive. That's just, it's most of them, but it's a lot of paperwork.
Yeah.
There are few online applications, so actually there's only 2. The combined application form that they would apply for SNAP, the food support program, cash programs, they can apply for that online. The healthcare, the only ones that can apply are the families and adults without children. So anyone in the elderly, disabled population, they're required to fill out a paper application, at times multiple. So if they're looking at long-term care services, either waivered services or a facility, they would have to apply for medical assistance first, and then there are supplements that they have to complete to get the information we need to get the long-term care determined. So it's a pretty hefty amount of paperwork that clients have to go through just to get the process started.
And we talk about, that visual is excellent, excellent. One application is one application. The eligibilities are different among the majority of them. It would sure be nice to have a system that you put your information in and all of your eligibility, your income, your age, and it would then tell you what you're eligible for. Yeah, no, that doesn't happen. But like Stephen said yesterday at personnel, when we were at personnel again, in a perfect world, that would be great, but there is also a lot of contributing factors that why maybe it doesn't happen. Federal eligibility requirements, some from Medicare as well, and then state programs. You know, they all don't work well together. So there's a lot of manual work that goes into processing these applications.
They occasionally attempt to streamline programs to get them more uniform in relation to each other. It's very, very unsuccessful. I can't say, I can only think of two off the top of my head. Right now, they're trying to get the cash programs, the family cash programs, closer to what the food support, you know, how that works, but it does lead to a lot of other issues. So there's a lot stricter requirements for family cash regarding assets and than food support. So then we get these reporting requirements. We're having a lot less contact with the clients. So that's pretty new. They're doing that in an attempt to get things more streamlined in, you know, with the programs, but the programs themselves and the policies that are inside the programs are so different from each other. To do it across the board just leads to some other issues too. So when you hear that, you know, they're streamlining doesn't always mean that it's streamlined.
And then you could add a language barrier to that. Whole nother layer of complexity and work that, you know, you're working through an interpreter, or we do have some of the staff that are able to interpret themselves when processing these applications, and thank goodness that we have those on staff, and their caseload sizes are high, very high, and very time intensive. Not to add the, you know, the program complexity itself. So for years of service, you see that we have a number of eligibility workers that have less than 1 year service. It takes 2 to 3 years, 3 years more or less, to be proficient in processing these applications because of the program complexity. Stephen, Laura, and Julie are having to review these until they are proficient in processing these applications, reviewing them before benefits are applied.
And that would be for different periods of time per program. So to use an example of the differences in the program, so the SNAP program, the food support program, you know, if things are going smoothly with training and everything, they could get approved to approve on their own in 6 months, say, but it can be longer than that. Healthcare for elderly and disabled, much longer than that. It's very complicated with the policy. So it depends on the program that they're working on, how long it would be before they'd be approved to approve on their own. So either a supervisor or a lead would have to, you know, get it approved for the final. So it's very time consuming. It's you know, if you think about working on an application, as complicated as they are, the workers are very familiar with it. So they've been there from the beginning. So then to come in and review it and get all those details from the interview and that type of thing where you don't have firsthand, it's, you know, we have to take our time and make sure everything, all the boxes are checked.
Which leads us, I think, why we are here today, and, you know, with our last work session and coming back, and our request was to add 2 lead workers in the eligibility under financial services because of the new staff. I mean, we're constantly training. There's a lot of program application with working one-on-one with staff in order to get these applications processed. Stephen, Laura, and Julie can't do their day-to-day work as supervisors and managers because they're having to carry a caseload themselves and help process applications. We can't get the work done. We can't get these applications processed as timely as we would like to.
And we are very much on track as far as timeliness. We do quite well compared to other counties. You know, some other counties can struggle with it, with their volume. I mean, you get the bigger counties, they're dealing with a very high volume. But we have not had, I think on the last review of the SNAP program, they do a management evaluation review for us it's every 2 years, every county. Some counties have it every year, some it's every 3 years. We have ours is every 2. And we didn't have any errors at all with timeliness. So there's many different, timing, processing timelines for each program. That's, again, is different for every program. SNAP, they're very, the food support program, they're very, they monitor it very closely. So it's a good indication of what we're doing in the other programs.
Mr. Chair, if I may. So the way I see it, you're looking to add 2 lead eligibility workers. Now, do you suspect that those lead eligibility workers would come from our current workforce, that is our 3 to 11 year, would move up into that, and then we would hire some more underneath them?
That's what we would like to see.
Okay, understandable. I'm just trying to figure, we're not really adding the help right away. You're adding you got the same people moving over that are already doing the same work. And do you suspect we could fill those lower level, the entry level positions quite easily, or would it be, it's kind of a.
Applicant pool, how's your pool been, Stephen?
It's
Nellie
improved
can-
quite a bit, I
Has
would
it?
say.
Okay,
Yeah.
okay.
In the last year or so, it's improved quite a bit.
I'm just thinking, are we actually solving the problem by adding the lead eligibility, or are we just pushing it down? I don't know. I don't know if there is an answer that makes it right, but.
Yeah.
Well, I think, didn't we talk about a personnel that having them actually be working, a lead is typically someone who's actually gonna be working some of the caseload
Yeah, they would definitely be working.
versus another supervisor, like, with me, which is kind of more of an indirect cost that, it's a little harder to justify, first of all, but, I think we need more people
Worker
in the
bees.
kitchen.
Boots on the ground, yeah.
So the way excuse me, the way we're looking at it with the leads is that if we're able to get a handle on that get a handle on the turnover and get the training done, if we have more, in the future, if we have more retention, longer term workers, eventually at some point, maybe we would not need as many of those positions.
Right.
To actually process, so.
Okay.
Why do you feel like we are having turnover? I mean, you said your pool is increasing now. Is it turnover because of workload or because of pay or?
Burnout.
I think it's burnout.
Okay.
It's very challenging. There's, it's challenging. I think a lot of people would assume because of these applications that they're just, somebody fills this out and they just put it in the computer and then it kicks out. But
Sure.
it's not like that, partly because of the system are so ancient, but it's also the worker needs to know the policy. They need to know the results. They can't just count on it. So they, to get them trained to do that takes, some time.
Right.
Right, and I could see, obviously they're working with people that aren't always capable to fill those out, so they're helping them and assisting them in multiple after multiple after multiple applications, and yeah.
I would say that's increased quite a bit. I think
Yeah.
with the through the COVID years, there was a lot of those extra funding that people were getting. And they were, like with healthcare, we couldn't close them. So they remained open for essentially 4 years, everybody did. And so then when we're doing this unwinding, it has increased anger and frustration on the client side because they didn't used to have to do this, and that we're very sympathetic to it. It's very confusing. They don't understand it, and, we have to do our best to explain it. But the policy is, vague at best. And so for us to, we're spending so much time interpreting that policy to help a client understand it can be pretty challenging. So that leads to that burnout and the stress with the, every day you're getting, there's little thanks. It's
Right.
everybody's unhappy.
Mm-hmm. Thank you. Yeah.
Do you, Stephen, just logistically, I'm trying to think it through. So do we provide walk-in service for our customers? So when they walk into the county office and they're looking for any of these assistants, our front desk staff at that point, are they going ahead and making an appointment immediately for one of the eligibility workers to sit down?
Yes.
It happens right away? Okay.
Expectation is if somebody presents, they are seen.
Immediately, walk-in service, okay.
And we have, like with the SNAP program or emergency programs, we may need to take action within 24 hours. So it's going to be to our advantage to get them when they're here to get as much information.
Is that realistic to expect same-day service?
Yeah, it's the expectation for some of the programs. If they can't be seen, we're required to get an appointment scheduled that day.
Okay,
Or the
but
next day in some cases.
they're either being seen or they're gonna get an appointment at some future date.
Yes, but in some of the programs, it has to be within, for us to process timely, it would have to be within 24 hours. So,
Do you feel that the expectation put on you is realistic then? Whoever put this expectation of the time frame on you?
I would say
On
if
us?
all things, if everything was in, ideal situations like those caseload sizes at the bottom are not realistic right now. But if we had seasoned employees, they would be, and that expectation would be reasonable to me. But right now, it's been very difficult for the last 5 years.
Thanks.
Mr. Chair, if I could, Jackie, you started about the same time I did, real before. But when you started, there was 2 directors, correct? How was that org chart divided back then? Did we take away some of these positions, higher-up positions at that point and put them workers, or how did
When we merged,
the org chart change when you started versus when it was broke up between 2 departments?
that was pre my time.
That was pre your time?
That was in 2012, and I started in 14.
Okay,
But
But-
yes, our org chart did change.
it did.
We added more management staff in there. And correct me if I'm wrong, Catherine, on the social services side anyway, we had the director, and then you had a financial supervisor and a social services supervisor. And then all the staff.
And then all the staff.
And on the public health side, we had a director, Cheryl Schneider, you'll recall, and 2 supervisors, I believe.
Okay.
Caveat to that, though, that was back when the programs were a little simpler as well, and not
Okay.
as complicated.
Well, yeah, because it's growing through the years. I mean, there's no question about it.
Right. Yeah, I can't imagine how they did their jobs and did them well.
So Stephen, you were saying if we have enough staff, but if we're lacking all the experience, if we had a seasoned staff, our caseload would be adequate.
I think it would be reasonable.
Okay,
Like
but
what's on the bottom of that.
we're just lacking all the experience, so what happens, 5 years, if we do get the experience, are we overstaffed, or what do we do with extra people? Or would it just constantly be growing? Is that the projection that we're always gonna be needing people, or?
It's a good question. Up until I don't know what's gonna be happening in the future, obviously with budgets and everything, but I would say that they continue to increase the population that would be eligible.
Sure, yeah.
We're not seeing that go down.
Right.
They usually make it that more people are going to be eligible for these programs.
Maybe we should show the
Yeah.
population projection.
I just wanna
mean,
make
Well,
sure. I just wanna-
Absolutely. I mean, yeah.
Oh, we're getting younger by the day.
Yeah, right?
I mean,
But
if everything stays the same and they don't streamline these programs and get into system modernization,
Right.
it's pushing it. 150 cases to do SNAP and cash programs is a lot.
And we're seeing our population be more diverse, different languages, and then the barriers that come with that. And then that increases our application, I don't want to say the application timeline, but the time that we have to put in with each application becomes more complex. But if you turn, like Catherine said, if you turn to document number 9 on the very last page or very last graph, you're going to see your age group projections.
Yeah, if you want to stop at keep going, Denise, go to the next one.
Very last graph.
Well, no, go here first.
okay.
This is seniors 65 plus. So this is 2024 to 2055. This is State Demographer's Office population projections for Todd County, right? And so baby boomers are all going to be 65 by 2030, right? And then they age, right? And so that's where you'll see, look at where we're at for 2024 and where we go. And again, those numbers go from 3.1, 3.2 up to, and again, this is male and female, so you got to add them together, of course. And then, of course, women live longer because we're better. So as they go,
Not helping.
but you'll see that number stays high, right? And I think that's what's important. We all expect this spike, but then you see how long it stays high. And then if you go to the last slide. And again, the race ethnicity, that's for the region, so it's not as helpful. But if you scroll down to the last slide, it shows, okay, so this is a little hard to read, but it's the decades, right? So we're currently, 2025 is dark blue, 2035 is yellow, gray is 2045. Just look at the 85-plus population right now that we have, right? It's 0.8, it's 800 people, let's call it, right? And then it goes to 1.6, right? So it's gonna double by, if you see the gray line, by 2045, right? So right now, you'll see we have a very high, if you follow just that blue line across, really high 65 to 69-year-olds, right? Their long-term care needs, their ongoing medical needs are not just something the county should be concerned about, everyone should be concerned about, right? And then who's coming behind them and how are we gonna grow that workforce to support that population? So it's not something, of course, only the county's gonna feel. But I do see with Stephen, I think, again, if we can't keep some of those eligibility workers, keep them and pay them well enough to keep them here, we're gonna all struggle, right? Because we used to have eligibility workers stay for 20 years. And I don't know what's changed, but if we can't keep some of our staff and keep the knowledge there, I think that's our biggest struggle, right? Is that we are losing so much knowledge, and then you have this huge population of seniors who need care, right? And there won't be enough nursing homes. There won't be enough senior living facilities. There won't be enough of anything, right? So it's gonna rely a lot on families and others. So just a thought to
Yeah,
think
and when
about.
you look at that particular population also, as far as the complexity of processing healthcare increases. So,
Right.
you know, you get to the, not the bottom, but the foster care, you know, the child in foster care, it's essentially automatic eligibility. There's not a lot of determinations for the MA, for the medical assistance part of it. As the population increases or you get into disabled populations, the complexity of the policy increases drastically. And then when you get into long-term care, it's a whole nother ballgame. So having, like, and Catherine's making a very good point that is going to increase, and I would fully expect we're going to have a lot more people on
About
assistance.
3-4 workers in that area, right?
Yep.
Thank you both for explaining that. I just want to make sure we weren't creating something down the road, a problem for you guys to deal with. And
Yeah. Well, and I think we all know with Medicare and with Social Security, something's got to give, right? How are we going to pay for all these things? It's not just Todd County, right? Todd County has a higher percentage than the state of those over 65. We're at about 22, 23% compared to the state's about 18. The biggest issue is behind them, right? We're going to see deaths surpass births really soon, right? And who's having babies in Todd County, right? And what does our tax base look like? And it's concerning.
And which is why I've thought, we come before you and do this presentation, why it's been good to look back over the years and what our budgets look like and how we've been good fiscal stewards of the county levy dollars and the revenues and expenses that are coming in, and how our staffing has adjusted over the years, because we do follow those trends and we have to be sure that we're meeting the needs of your constituents, our neighbors, and our communities. So we do, those staffing needs do fluctuate, and there might be some pluses and minuses along the way, but we really, really try to follow the needs of what the department is, and capture on those opportunities when they exist, either through resignations or retirements.
And one more point as far as the leads, Commissioner Noska had a good question as far as that, if we're pushing something down the road. Well, the way I look at it is that the staff deserves and needs one-on-one attention. So their training is going to be faster. So if they have access to that all the time, they're going to be up and running a lot faster.
Okay.
So that's how we're looking at that too.
They're getting dedicated time versus a revolving door.
Really hard right now for us to do that. We essentially drop everything we're doing right now, but sometimes there's things we can't, and then they get put off, and they have to wait for us to get to them, and it disrupts the learning process.
So a request is to bring this to board on Tuesday, to hopefully be able to have that on the agenda for the 2 lead workers.
Discussion on that? Bringing it to board? Bringing it to board?
I don't know. Do you think it's best to add them both right away, or would it be best to start with one? Or doesn't that fit? That's just a question.
Are we
Go ahead, Stephen.
cuffing you?
Well, we're currently don't have,
Any,
we won't have
Right
any as
now.
of tomorrow, so.
because as of tomorrow, our only lead eligibility worker resigned.
Yes, we put,
So there is a need today, and it would,
I
think would
mean,
When we look at, excuse me, when we look at the org charts, are these the 2 positions here? Or,
Yeah.
I mean, we've got several different charts up here.
right. So I've got the draft, and then I got the current stapled to the draft. So you know what the current is on the back and what the draft is
Okay,
on the
this is the
front.
current one,
That's the current.
and this is the new one.
Yeah, so you have something to compare it to. So when you're looking at the org chart, you know, at the end of the day, this is kind of what we're considering it to look like with the split of the administrative services department. So we would put the front desk, focus on the financial support services manager, which is Stephen. We would, they would have 2 lead eligibility workers are in the hot pink. And then 2, they're case aides. We'd put the front desk under them and along with the case aides. Because right now, the front desk was under Jenna's
Jenna.
unit, but the majority of the work they do supports Stephen's unit. So, I think we can do a better job in helping them, and getting them proficient with how they do their work in supporting Stephen's unit versus having somebody else who doesn't really, I don't wanna say know the work, but really do the work.
or maybe should be focused on just the financial, the accounting side of it, which is what I understand that,
And then we're asking to split that accounting side.
So Jenna
because
had front desk plus
The accounting,
the accounting side.
correct.
And the thought process is potentially to, as we just, let's play the domino game. At some point, Jenna she has a contract with us for amount of time, but if we decide today that we don't want that contract, we have to give her 30 days, and she has the same right to us. She could give us 30 days, and now what we do if she called today and said, I can't do this anymore, for whatever reason, what do we do?
Scary.
Who steps into that role to say, in 30 days, I'm gonna know everything she
Cry?
knows?
My other question is, the dark blue ones, what do they represent?
Dark blue are, that's Abby, is the administrative coordinator, so I would keep her directly under me. I wouldn't assign her to Stephen's unit or to the accountant supervisor, because she really supports us all in her day-to-day work. The, those other 2 had been their front desk staff. We would put them under Stephen's unit, so they had been under Jenna's unit. Same with Abby, under Jenna's unit. So we're really trying to, so the hot pink are the new positions. So the accounting supervisor is, again, I'm requesting to come to board to hire a supervisor versus a manager, and then relabel it, not an administrative services manager, a supervisor. That's a new position. And then the lead eligibility workers would be new, but those would be under Stephen. The navy blue are existing positions that we would just split out. Does that make sense?
so you would, like to fill those leads probably internally, I'm guessing?
Yes.
And then those would we repost for those other ones
Yes, it'll be a
immediately,
domino.
or?
Yes.
And as far as that, your question about posting them all at the same time, what we're looking at is doing it with the program complexity. We need the lead worker is gonna need to know all the programs, but they can't be the masters of every one of the programs. So we're looking at having each lead is gonna have their area, that's their focus, and anybody can go to them for those needs. So having just one, it was pushing it to have one right now with these programs.
You said one lead might specialize in 6 of those applications, and another one might specialize in the other
Other
6 or 7?
Yeah.
Yep. So we'd be looking more like
So
the Met system is the majority, yeah, it is the majority of the healthcare, so probably have, one that's very proficient in that Met system, and then more of an adult and family. So when you get the long-term care and adult side of it, and waivered services, that type of thing, and then the family with the foster care and adoption assistance and family programs.
Then those leads would be overseeing the other case aides that would be open, or you?
They would be reporting to, we'd be splitting those up amongst
Gotcha.
the management. Yeah.
Okay,
Because they would be supporting, based on what that supervisor supervises, they would be the support for that staff.
Okay.
And I can talk a little bit more about the supervisor position when we're done with those questions for Stephen.
yeah, I just want to make sure we're on.
So Stevens' org chart would change,
Yes.
okay?
Yes.
And is that the only one then, or would it be the financial?
Primarily, I mean, Abby would come under me, the administrative assistant or administrative coordinator would come under me. And then we would reassign the staff under Stephen for the front desk. And then when we're talking about the accounting supervisor, that is attachment number 10, the job description that's there. The accounting staff would go under that position. So we would eliminate the manager position and add the supervisor position. The manager position, Jenna was experienced, come with a lot of knowledge, years of knowledge. So she was able to do that and do that job very proficiently. I think it was a big job for somebody to be able to come in and fill those shoes. It was a lot to expect somebody off the street with that kind of experience and that kind of knowledge. That position really, we need somebody with general ledger and accounting experience. Somebody that can work closely with Denise's office. And then oversee the accounting staff. So that's where that would split out. It's a cost savings, but there's also 2 eligibility workers we're requesting that to add. But I think, as we look at some of our programs and do some reassignments with staffing, the care coordinator absolving that open position. We do have 2 social worker positions that we have not posted that are sitting there as well. That there is some cost savings to those as well. So again, I thought this entire picture would be good to present this all to you, is that we've been really good fiscal stewards of the county levy dollars and our budget. And we follow the trend in what is presented to us as a Health and Human Services agency, and try to do what we can to best manage the programs and the staff that we have. And at this point, this is how we feel we can best do that and get the work done. Because right now, Stephen's unit is struggling.
All right. Mr. Chair, if I may, speaking of budget, adding 2 new positions does incur a financial liability. Now, do you suspect that would be easily attained by your department? Like, could you easily fund those positions without any excess from the county levy or anything like that? Would it be?
I think we have enough cost-saving opportunities to be able to absorb that, yes.
Okay, yeah.
Over time.
Right.
Over time.
Okay.
The elimination of the care coordinator position, we had budgeted almost $92,000. So $91,881. That one position. There is another opportunity that is considering that may be a cost savings of just over $71,000 as well. So that alone would be an opportunity, so. So again, here's another request is coming to board to present with a BAF or that accounting supervisor, so we're able to post that as well. And the last attachment is 13. That is just the same org chart, but with names attached. The draft, the proposed, and what is current. So again, those have all the open positions and all the names that are attached to what this org chart looks like. Instead of titles, they're people. Whether they're here or the position is open.
And I know that we haven't been contracting with Jenna for very long, but as we're contracting with her, in essence, we're saving some dollars as well because she is a straight hourly per charge, no benefits. So that has been a cost savings for you too, depending on how long before we would
Correct.
fill that position.
It won't be a cost savings going forward, though.
From a
Once
manager or
we
a
hire it.
supervisor, it will be a small, a grade. So what is it in between grades?
We would send this in to Gallagher because duties have been removed, so we're anticipating the position will not be the same grade.
Okay.
It will lower,
Right.
most likely.
Okay.
And Jenna was, I think, a step 9, knowing what kind of experience the individual would have coming in could possibly be less as well.
Got it.
Has this job description been graded? Because I know that was one of my comments from Tuesday's meeting that I had written down.
I'm gonna look to Nellie and Jackie as they get to speak.
not been graded yet.
It-
We have to send it to Gallagher.
So then we won't know the financial implication moving forward.
It would just depend on how soon Gallagher can get that turned around.
We're hoping that it'll be quick enough that we can add that.
Yeah, because I'd hate to be
Right.
presenting a board action without that listed in there.
Right.
We could have, we could have the board action prepared and then have it presented hopefully by Tuesday with,
And I can ask Gallagher, what's the probability of it being done by Tuesday morning?
Oh, you can tell them we need it done by Tuesday. I mean, seriously, we paid them a lot of money to do what they did. They need to get it done.
amen.
Yeah, I agree.
I'm serious. I mean, we gave them a ton of money. They owe us something here.
Well, they need to be a good service provider. They should do it, yeah.
And you can say that comes from the commissioners.
Well, I mean, the front desk thing, moving to Stephen, is almost a no-brainer in my mind. I mean, I just don't know why that, I think it was, not hindsight's 20/20, but that makes,
I did,
finance, to me, you really gotta focus on this finance thing as far as, I think it's great that we have the situation that we have right now. I wish it was the other way, like, we still work here, I'm gonna be honest with you. But we at some point got to take control of that, because right now, we have an agreement, but I mean, something could happen. I mean, physically, mentally, to anyone, and if we're gonna have to deal with that. And we're better having stuff in our control versus not in our control, in my own estimation. The other thing is, I mean, it's, in the last 6 years, we've had some crazy times, right? I mean, COVID was what it was, and I can't even remember what happened in 2018, but clearly our team has been a good stewards of the money we've been, trusted in them. I mean, is there some glaring thing not to bring this to board for everybody? I mean, I think the question is, affordability, but
It is right now, and I think the other thing is the state and federal programs. And we're kind of sitting in limbo. We hear a lot on the news, but nothing definite. And I think that's just kind of the side we're sitting on right now is like we're sitting on a wall, and which way do you go, you know? And nothing's coming back that this is going to actually happen or this is not going to happen.
Right,
Is
and
that uncertainty?
And taking the, I mean, so my comment on control goes this way, is that this team has met for, how many times have we met about this? Multiple, spent hours working on it, right? I mean, we cannot control what state or federal does. We can just control what we can do right here. And if the team, in my mind, if a team needs something, I mean, these are, I don't call people tools, but they don't have, apparently, and these caseloads are a lot higher than I thought they were gonna be. I really thought, John, you're gonna come back with some number that was gonna be like, gotcha. But they're high. I mean, in my mind, I don't know what's there, but it seems high to me, so. My point is, this is a control thing we can control, and you can control pluses and minuses, you know what I'm talking about? Staffing can be a plus and a minus. Just because it's a plus today, doesn't mean it be a plus next year.
So if I may add, Mr. Chair, that I did ask 13 different, and I didn't get all of them that I asked, but counties as to what their org charts look like.
Yeah.
It's a mixed bag, but the majority of them do have front desk under the financial services, what we call financial services unit. So a variety of them, you know, ultimately counties do what's best based on how their org charts or their counties are set up. Some of them are, like Wadena County, still a social services and a public health, where the majority of us are at health and human services. But yeah, so it's a mixed bag on how staff are assigned out or org chart out into the department, but the majority of them do have front desk staff under the financial services side or unit. Case mixes are high though for us in comparison to our contiguous counties, but many of our counties are facing the same trials with staff, or people are more mobile than they've ever been because of remote work options.
Well, folks, what are we gonna do here?
I have one last thing, is the job description there for the, had been case aide / interpreter. We've been working with Nellie and the personnel committee around that job description. But you can let maybe Nellie or Catherine kind of take it over for here, but I have that up, or we have that up as to a position title being the resource navigator / interpreter.
Yep, just a little background. So we brought this to work session. It was a case aide / interpreter. Currently have a case aide in my unit who is acting as an interpreter, and that's not in her job duties. So we want to make sure she has an interpreter certificate, but it's a huge need, right, to act as an interpreter, not just a bilingual speaker for our nurses and for a lot of our home visits. So we wanted to change this job description, and Nellie brought this one forward. I think it's a really good job description, different from a case aide, but a lot of the same duties. It'd be called a resource navigator / interpreter, which I think has worked well in a lot of other counties. We did some smushing of duties, and I think it looks good. So again, it just has to be graded by Gallagher.
And I wanted to mention that we brought that back to personnel this week, and they said, go ahead and bring it to board, but I wanted to be able to mention that here at the work session, so we're following protocol.
You know, I got a interesting question, whatever. I spent the other day.
The experience requirements. So again, that minimum of 40 hours interpreter training and being bilingual is a requirement, so a minimum requirement, and that's different than our other JDs.
I spent the other day with my mom, who is 95, and we had this conversation. And it's like, who's responsible for the communications? Is it us as a county, or is it some of the responsibility should not be laid on the people coming in for services? in the past, it was always the people coming in for services, you know, and so with the conversation with Mom, it was interesting how all of a sudden it's laid on us to have that communication and not on the people coming in.
Mr. Chair, if I may.
That's not how it is
I have-
today,
I-
but.
I have a comment. I'm just saying as a, that may be true if we were, 5 or 10 people, but when we need that resource in-house now more than ever to make that language barrier. I get it if it was them, one or two people coming in and needing that, yes, but when we need that throughout the county in this building, that's where the big advantage is us understanding how to interpret that and us being able to apply that to the right areas. And I think that's where we've changed so much as a county. And again, our population is very unique and diverse. So being able to offer that service just to add it to one of the many services that we offer right now, I think is an asset to our county and to our staff. I mean, it's probably a huge relief on them, but we've changed so much,
We have, but you know,
I understand.
back in her day, you seen the same thing, where there was a lot of different languages talked.
Yep.
And you go out, and a lot of people say, well, no, they understand you, they just don't want to talk it. So at
It
what
is
point?
different, and Stephen knows this too, we have a civil rights plan, a limited English proficiency plan that is required, right? So we have to offer interpreting services, have to, right? We've been offering those typically through phone or video interpreting, which is $1.40 to $1.50 a minute. So again, I completely understand, Commissioner Becker, it is a cost savings, and again, in public health, if we didn't have 40% of our caseload speak Spanish, it might not be a need, but that need has only grown. So it is something that, again, we didn't have 10 years ago. It has shifted with our population. And I do think it is a challenge now with populations that are coming and going, right? There isn't always that support there, and often it is, the county is where they come, right? For that, we are a small county, and sometimes our county has to do more, and that's unfortunate, but we don't have nonprofits, we don't have advocacy groups, we don't have refugee settlement agencies, those type of groups that typically would do this advocacy work, we don't have those. So it does come to the county sometimes, unfortunately.
Yeah.
I mean, I would argue that I've learned some stuff today, like, this is just my one person's opinion. We have a non-mandated program that's serving 38 people. That's like 1/10% of our entire Todd County population. And I know that I think that the services of this resource,
Repeat.
Yeah, okay, thank you, was gonna serve more than 38 people.
It's right now. Mr. Chair, we have a drill coming in, so are you
Yeah, in
recessing?
like 2 minutes.
Well,
What's coming in?
they're already going out. The
Are
red
they?
alert went off our phone, so we need to recess and come back, or,
It's a tornado warning, or tornado practice.
Practice?
Either you end it
but we
or
have to
we-
leave the
gotta go.
building.
I gotta go to
Fire drill.
Lowry.
And, yeah, we have to go to Lowry, so.
Okay, I guess we're going to.
Recess, or,
No,
I'm not
they've
trying to
got-
cut
they've got
anybody
it-
off,
they've-
so.
Yeah, I don't want to cut anybody off too. We have to know, you want to know if you can bring this to board, so you can always bring it to board, and if you get a,
Table too, if it
you get a
absolutely had
motion,
to,
yeah,
but
if we can't figure it out, then you could, if they get a motion, we'll act upon it, if they don't.
Can we at work session, or is it for discussion, for direction?
Are you bringing it to board on Tuesday, or are you bringing it to work session? No, work session is the
Can't.
state people.
So,
Why can't we bring it to board? You can still make a motion, it can be
Well,
motionable.
if you bring
If
it
it-
to
if we-
board, we can table it at board, or
Yeah.
we can vote on it at board.
Somebody
or-
makes a motion and,
well, can we put it as an agenda on put it on the board, and if we table it, have it on the work session to discuss if we need to? I mean, just so it's there.
yeah,
Well, we're not moving anything to the work session because the representatives are coming
Oh,
and
that's
they're
right.
taking the whole
That's right.
time.
Okay,
put it
But
on the
if-
board.
board.
Yeah.
forget about it.
okay.
I think this is very, very informational. Thank you, guys. I mean,
Absolutely.
Yes,
it's-
thank you
The
all.
board
Appreciate
is
your time here.
The board agenda will be going out tomorrow,
Yeah.
and so this is
Oh.
going to come on there, but it's not gonna have the financial implications, because obviously.
We can work to get it graded ASAP, hopefully.
Yeah, if they got it.
Okay. I just wanted to clarify that, because it won't be
Sure.
on there, and that's always been
Hopefully it will happen.
a stickler by the board that it be
Yep.
listed.
We will amend if need be.
Yeah.
Okay, thank you.
Okay.
Work session closed?
Session, do I need to close this?
No, it's a work
good?
session.